Hello and welcome to the Scottsdale Top Docs podcast, where in each episode we focus on bringing you the very best education on evidence-based medicine with the mission of helping you, our listeners, lead healthier, more informed lives. This episode was brought to you by Dr. Saithna, an orthopedic surgeon specializing in minimally invasive and arthroscopic knee and shoulder surgeries. He's been awarded the 2023 Maricopa County Medical Society Outstanding Physician Award and has been published in over 250 publications. His work has won the highest awards from the Arthroscopy Association of North America and the Royal College of Surgeons in the UK. Dr. Saithna is independently ranked as one of the top 25 ACL surgeons worldwide and has published extensively on ACL, meniscus, and sports injuries of the knee and shoulder. You can find him in Scottsdale, Central Phoenix, and the West Valley. Find out more at Scottsdale Top Docs on Facebook, Instagram, or our YouTube channel. And on to today's episode.
Hello and welcome to this edition of Scottsdale Top Docs podcast. My name is Dr. Adnan Saithna. I'm an orthopedic surgeon based in Scottsdale, and I'm very excited about today's episode. We have two fantastic guests with us, Daniel Backx, who's a doctor of physical therapy, and also Mike Tully, who has recently climbed Kilimanjaro. So I'm particularly excited about this episode because many people have arthritis and knee issues, and when they have those, they feel that they can't participate in the normal activities that they want to. But this is a really great example with Mike recently climbing Kilimanjaro with an arthritic knee and a meniscus tear. And he's going to explain to us what it was all about and how he did it.
Well, first of all, I didn't know I did it until July 1st. But tore my meniscus on a normal trail run. I do a ton of hiking and mountaineering, probably a little over 1,000 miles a year and 300,000 feet elevation gain. And I had no knee issues until July 1st. July 1st, I finished a trail run, one taking a long car ride to California, stepped out of the vehicle to get some gas, and suddenly I had a knee problem. So I saw Dan immediately when I got back home, worked on me for 2 weeks, and we said, oops, this is not working. And I had a important climb in Tanzania, which is Kilimanjaro, which is how I got led to you. So my knowledge of having arthritic knee is basically a brand new event, actually.
Right. But I think even despite that, well, firstly, I think it's interesting to know that you can have arthritis and actually not have symptoms. And so whenever Dan or I see someone who has arthritis, our aim is to get them back to that status where they have minimal or no symptoms and can actually get on and do the things that they want to do. Dan, do you mind telling us about your approach to evaluating someone who comes to you with knee pain?
Yeah.
And also maybe you can tell us a little bit about your background and also your office, Endurance Rehab.
So yeah, my name's Dan. I'm a physical therapist. I did my doctoral training in Springfield, Massachusetts. Came back to Phoenix, Arizona about 6 years ago. And so I've been with Endurance Rehab, which is primarily a sports orthopedic company, but started as a niche orthopedic company treating primarily endurance athletes. So our owner, Nate Koch, he started the company about 20 years ago. And I've been with the company now for about 6 years. Based in North Scottsdale, we also have an office in North Phoenix in the Arcadia region. But going back to Mike, I've known Mike on and off, treated him for the last several years. He's a very avid climber. So knowing that his level of expectation when it comes to orthopedic management is high. And so when I had suspicion that this was potentially a meniscal tear, I wanted to get him over to, who I thought could manage the intervention as quickly and as efficiently as possible. And so with the potential for this to be arthritis, thinking that we might want to do a cortisone injection, Dr. Saithna was my first bet. So we're able to get him over to you for quick, immediate management and resolve the situation.
Sounds good. Mike, I don't think most people kind of can understand or comprehend what it takes to climb Kilimanjaro. So can you help us understand that from your perspective, especially from the perspective that just a week before you were you had severe knee pain. Did you think that you were going to able to complete it? And what does it really take to do it? Can Dan and I do it next week, or do we need to do some more training?
Well, first of all, I think Kilimanjaro is actually, not to play down on it, but Kilimanjaro is one of the most doable of the 7 peaks by far. The training I've done, typically this is a great training ground here in Arizona, just the level of mountains. So I think it's a very doable climb for most people. That being said, if you're just walking flat trails, it's not a doable climb. You need to be climbing. And if you properly prepare and you're doing camelback, you're doing the McDowell's on a regular basis, I think almost anybody can do it. If you looked at who made it to the top, some of them were throwing up. But the fact of the matter is, there's a group of people that made it to the top that you look at and say, wow, I'm surprised they made it to the top. It's a very doable hike.
And when you mentioned the 7 peaks, I think not everybody will understand what that means. So can you tell us a little bit more about that as well?
Yeah, the 7 peaks are the 7 highest peaks on 7 continents.
Right.
So I've got one more actually right now. I'm looking at right now, but it's a longer climb, so we got to get my knee completely better before we attack that one.
And how high is Kilimanjaro?
19,340 feet.
Okay, so that's a pretty big peak. And how long did it take you?
The climb I was on was a 7-day hike. So the first day of the hike was a 4,000 foot elevation gain hike, which I do on a fairly regular basis. The last day is also a 4,000 foot elevation hike. So it goes from 15,000 to 19,000. And in the same day, you're going down another 9,000 feet. My biggest worry with my knee wasn't climbing. My pain was actually more on flats and downs. So the pain I was getting with hiking during the month of July was typically anything going down. So my biggest worry wasn't making to the top. My biggest worry was, can I make it to the bottom, or do I need to be flown down or carried down?
Right. I think obviously you say it's very doable, but probably Dan and I wouldn't be able to take the week off next week to go climb that. So how do you have the time to fit in all this activity?
I semi-retired 5 years ago. I was the CEO of AAA locally here, and decided that I was at a place in my life where I still wanted to work. So I'm an independent director for a few firms here in town. I've got a small investment banking firm I'm getting started right now. But I'm trying to make my work schedule go around my hiking schedule. I've decided my health at this stage of my life, I turned 59 actually during the hike, first day of the hike, is an important part of my being. And I really want to make sure I focus on just exercise. So I've been on a probably a 20-year process of hiking, but it's gotten more intense. Actually, the day I retired, I booked flights to Spain and hiked 500 miles across Spain on the Camino de Santiago. Over 26 days. So most people saw me, said, "You're nuts to try and do it that quickly," but it was a really, really fun journey.
Yeah. I think that many of our patients like to hike regularly, but they might be doing short hikes once or twice a week. So what advice would you have for them if they have a diagnosis of arthritis from your perspective, in terms of, firstly, you discovered you had a problem. How did you decide, where to find a good physical therapist, and what did you look for to try and identify someone who you felt was going to be able to help you?
Well, I have direct deposit, I think, with Dan's place right now. I frequently go to physical therapy just because at this age and the level of intensity I have in training, just different stuff happens. So I regularly use physical therapy at this stage. I think the issue with actually, let me start your question over again. I actually lost the
start my question over again. Yeah. Well, I think my question was, let me remember it as well.
I lost track of your question.
My question was basically that many of our patients, they enjoy hiking, but it's not the level that you're hiking at. It's recreational hiking. They do it as a hobby. They're working full time, or maybe even they're retired, but they just don't love hiking as much as you. But when they discover they have a knee problem, they're kind of lost and they don't know which direction to go in. And so the question is really about how you picked your physical therapist and what you look for in a good physical therapist. How did you end up with Dan at Endurance?
I've used physical therapy for a long, long time and used several different firms in the past. Endurance Rehab for me has been one of the much more aggressive firms. They actually saw my daughter through two ACL surgeries and recovery. And my view of physical therapy is one of, I want them to fix me.
Right.
I don't want to feel comfortable.
Yes.
So my personal point of view is don't go to physical therapy and try and find somebody who's going to not hurt you. Because sometimes physical therapy does hurt, and you want the physical therapist to push you to get better, which is frankly my criteria. And Dan on a regular basis tries to hurt me. So that's a good thing.
Right. From my perspective, from a more medical kind of overview of what you're saying, I feel that many patients have been to physical therapy and they didn't get better. And then they have an opinion of physical therapy that it doesn't really work. And I think you've highlighted a really important point there, is that if you see someone who's very skillful and knowledgeable and knows how to actually address your problem, that physical therapy is actually extremely useful. And that's really a powerful message coming from someone like yourself, who's obviously got all these fantastic achievements and has also recently got over a significant problem. So let's hear from Dan about what he does differently to get people better.
Absolutely. Yeah. And it's a really great point that Mike brings up. I think physical therapy can get a bit of a bad rap, both from patients, the population, and even people in the medical community. So surgeons themselves. But it's not that, we go out of our way to hurt every patient. It's that we want to provide the patient with the care that they really need, right? And so as a physical therapist and endurance rehab as a company, we will treat patients of all ages. But the one thing that we have in common is that all of our physical therapists are athletes or prior athletes themselves. And so I think what Mike's trying to say is there's a level of intensity there that sometimes needs to be met in order to achieve your goals, right? So if there's a particular injury or ailment that may require a little bit more intensity and volume that maybe the layperson or the non-athlete couldn't handle, someone that's going to hike Kilimanjaro needs that. And they need that in order to achieve the tissue change that's going to allow their symptoms to resolve.
I'd only add one thing, which is I think the ownership on your relationship with the physical therapist goes both ways. And I think the pain I was teasing you about is as much self-inflicted in the fact that I'm asking, saying, hey, I want you to push me harder here because I don't think it works. And frankly, having somebody at a professional standard that you can say, hey, here's the way my mind goes and here's the way I work. I want to make sure I'm not hurting myself by pushing too hard through something.
Absolutely.
And having the right advice by the right physical therapist that will push you as hard as you need to be pushed and tell you whether or not you should be pushing harder or less,
right?
Is really what you're looking for in a really good physical therapist.
Yeah.
Right. And I would just touch on it and say, I think what we strive to do, and maybe we do a bit of a better job, is building those relationships, right? And knowing that if I treat you and I treat you well, I'm going to see you again in the future, right? And if I have a good relationship with you, if I have a good relationship with Dr. Saithna, that's really allowed this patient pyramid to work really smoothly. So I know Mike's personality and what Mike needs, and what Mike needed was a physician that could treat him at the most appropriate level to get him to Kilimanjaro.
Yeah. One of the other things I'd like to touch on is we're kind of joking a little bit about no pain, no gain, but actually the reality is a little bit different to that. And I think if we talk about physical therapy causing pain, it might intimidate or scare some patients. And actually, the idea is not really to cause pain to get there. But I think you said it very eloquently. It's about having the right intensity to actually build muscle and get stronger. Because when patients have arthritis, surgery is typically the last resort. And we can do injections, you can take anti-inflammatory medication. There's lots of other measures, which perhaps we'll talk about in a moment. But what really makes the long-term difference is actually your muscle strength. And so, for example, when we walk up and down stairs, the amount of load that goes through the cartilage behind the kneecap is many times your actual body weight. But if you have good core stability, good lower limb muscles, that's actually protective, and it reduces some of the abnormal forces that go through there. So for the people at home, they have some knee pain. What advice do you have for them? They want to go hike Camelback, but the knee's a bit painful.
Sure.
How do they find the most appropriate physical therapist for them?
Yeah.
Why is it you? And what should they be looking for basically to get
Absolutely.
better?
Yeah. I mean, first and foremost, the patient, the client should be looking for a physical therapist that's going to meet their goals, right? And so what that means is listening to the patient. You need to feel heard, and you need to feel like your time is well spent with that therapist and that they're listening and can build a good relationship with you, because no patient is the same. The way that I might treat Mike compared to the way that I might treat you, we could be doing two different levels of intensity that would, scare somebody away, right? So if you walk in and see Mike on the table, I don't want to see, my patient that's up next thinking that that's the level of intensity that I might hit them with, right? But the biggest thing is that you take an individual tailored approach. You evaluate the patient well. We make sure that we mark out enough time to get a very thorough evaluation with the patient. We pride ourselves on doing a lot of functional testing. A lot of our patients, like you said, are everyday weekend warriors, hikers. They're out in the Arizona desert. They're trying to get back to their activities. And so I think going through a very thorough evaluative procedure, and then following that up with structured therapeutic exercise that's focused on not just maybe what they think they need, but what we're seeing as the specialists to target everything.
Yeah, excellent. Mike, I see that you're wearing the brace we prescribed for you. I really like these braces a lot. The idea behind the brace is that if you have arthritis in one part of the knee, it tends to get overloaded, and the brace basically takes pressure off that side of the knee and gives some relief. It's really good for people who are active like yourself and wear it for periods of activity. But if you wear it all day long, I think you actually found it very comfortable and you've been wearing it for many hours. But some people find the force it takes to take the pressure off the damaged part of the knee is uncomfortable after a long time. Do you mind talking about your experience with the brace and how helpful you found it?
Yeah, my experience with the brace was almost the opposite. And the fact that the initial discomfort in the first hour or two was almost annoying, and the fact that there's a little bit of pressure on the inside of my knee pushing. I looked at the decision to get the knee brace and wear it. Number one, I wasn't going to buy it and not wear it, particularly for the fact I'm going to Kilimanjaro. So I actually wore it religiously every day. I even started wearing it at night.
Right.
And I wore it at night because even sleeping the way my leg was laying, I'd wake up in the morning and my knee was hurting a little bit, and it kept my leg properly straightened even at night. The brace itself is amazingly functional. I had no issue climbing. There's an area called the Bronca Wall, which is a 1,000-foot cliff basically that you're climbing straight up.
Right.
So deep step ups where you're holding boulders and pulling yourself up. Zero problems from a functional standpoint. I wore it underneath my heavy clothing on the last day. I was in 0-degree weather and fit perfectly underneath. It's perfect.
Excellent. And had you tried other braces previously?
I've used knee sleeves before, and I've had I think I had a brace probably 20 years ago.
Okay.
That just wasn't very functional and actually did not wear it. So
how do you compare this brace to those? It does something very different and specific, right? It offloads that pressure, which simple knee sleeves or over-the-counter braces can't really do. This brace was custom made for you, wasn't it?
Yes. Yeah. It fits perfectly, doesn't slide. I think there was one time where I had to try and adjust and pull the brace up a tiny bit on my leg.
Right.
After a long, sweaty, hot day of hiking. But it's functional. It doesn't lock up. It doesn't cause a problem with you bending your knee. I actually forget that it's on when I'm hiking. So, and it's super light. The only bad side is I didn't realize that it rings a TSA. So I got yanked off my lines.
Oh. And what percentage improvement in your symptoms do you think wearing this brace provided you?
It's hard to give a percentage just because I don't have the alternative.
Yeah.
I don't know what I would have been like if I didn't wear it.
Right.
I think it gave me a huge level of comfort in the fact that I know I'm not going to be able to turn and have suddenly my knee turn the wrong direction and cause acute pain. So my issue was I saw this as an insurance policy.
Yeah.
I found this was non-systemic risk that I could get rid of. And I wanted to get rid of non-systemic risk. So I said, this is one of the areas I can take care of. You can train really, really hard, gets rid of risk of not making it to the top. I can get a knee brace. I can take anti-inflammatories. Those are all things that mitigate the risk of making it to the top. And this was originally an insurance policy, but I think it's actually was a good one, because I think it's actually does provide a lot of stability. I don't really feel like the knee is unstable.
Right.
That being said, one step on a turn, you can tweak your knee, and I think it stops that from happening.
Right.
Yeah.
So I know that you're doing some more impressive challenges coming up in the near future. The brace is a good solution to help while you're training for that, and obviously for the next events. But at the same time, we want to get you in a better position where it's your own body that's supporting your knee better. And so, Dan, maybe you can tell us about what your plan is for Mike's rehab over the next few months.
Sure. Yeah. So getting Mike back in the clinic over the next few weeks, the important thing will be making sure we're doing everything to control the pain first and foremost. So once we have the pain under control and Mike's well educated in the things that he should and shouldn't be doing, then the next step is going to be building out a plan to really focus on the stabilization of the knee. So as you touched on earlier, it's not just the compressive forces that are laying down into the cartilage on the patella, but how can we strengthen the muscles around that girdle? And so with Mike being such a compliant patient, he's bought in, he has such great trust in his providers. I know that whatever I give him, he's going to be able to follow through on. So we will certainly be going forward with more of a progressive compound exercise program. We want to really focus on the posterior chain. So the backside, his gluteals, his hamstring musculature, his quadriceps or his thigh muscles, and making sure that we're going through more of a eccentric or a descent style programming. So what that means is functionally doing things that are going to replicate him stepping down, right? So he can step down in a pain-free manner.
So many of the exercises that you mentioned, they're available. You can watch them on YouTube.
Yeah.
So why should patients come to physical therapy rather than do these kind of exercises by themselves?
Yeah, great question. Now there's exercise programs, or as you mentioned, physical therapists, they're a dime a dozen. And so what's going to make physical therapy or a good physical therapist different is building out a tailored approach and a very specific home exercise program that Mike can replicate, making sure that Mike is doing these exercises in a way that's going to allow him to not degrade his joint line any further, and keep as much alignment through the knee as possible. And so I think that's where a trained eye and a specialized eye is going to make a difference over a cookie cutter program that we might get on the internet.
Yeah, absolutely. I totally agree. I see many patients who have tried to avoid going to physical therapy and followed some of these exercise protocols on YouTube or other sites. And there's some good quality ones out there, but the difference is they don't have you or another physical therapist supervising them, making sure they're doing the exercises correctly. But also, as you mentioned right at the beginning, you individualize the care that you give to every patient. And so not every patient needs the same exercises.
Right. It's rare that we will have a case where there's complete overlap of exercises, right? I would say almost every single patient and case that I see has a level of individuality and tailored care to that. And I think Mike's a testament to what it means to buy in and trust his providers, because he has all the resources in the world. He could find any program or personal trainer out there, but by following the things that we've done and the network that we have for Mike, he's gone from being pain-free, unable to hike the small peaks around the valley, to hiking Kilimanjaro.
Mike, obviously we heard that physical therapy has been really helpful for you, not just for what you've done recently, but over the years. And obviously the brace has also been very helpful. But what other things did you find helped you get over your knee issues so that you were able to hike Kilimanjaro?
I think number one, getting into your office as quickly as we got in. I think we were on the table at 3:30 in the afternoon, and we got halfway through the session, and Dan said, "This should be cleared up by now. There's something else going on. I've got a good friend." And I said, "Well, call him." So he said, "Right now?" And I said, "Yeah, call him right now." So he literally left the table, called you, and you were across your office that was across the west side of the valley. I probably drove a little faster than I should have, so there's any DPS officers listening. It wasn't me. But bottom line, I got into your office that afternoon. By Monday of the next week, We had a cortisone shot scheduled, and within 1 week after that, I was leaving for Kilimanjaro. So I think just getting the proper care, and frankly, I think all those things helped. It also was very, very helpful actually being able to try this brace out while hiking. So I had a week of training, not aggressively, but basically really more to try the brace and see whether or not this was going to be functional or not. And it required some adjustments. So I made some adjustments to it in your office, and it was terrific from there on out.
So Dan and I work very regularly together. We share a lot of patients. So when Dan called me and told you what you were trying to do to climb Kilimanjaro, we did everything we could to get you in the same day and make sure that you're able to get there and achieve it. But I think the main thing that I did to help you, apart from the brace, was the injection in your knee. How was that experience for you? Many people kind of worried about having an injection in the knee. Sounds painful and unpleasant. How was your experience?
Honestly, I didn't really even feel it. The injection's a non-issue, and frankly, the relief is almost instantaneous. Within a day, I was feeling better. By the second day, I was really feeling a lot better. Unfortunately, I think where it's at, I started getting some pain back a little bit within about a week, and that's why I'm glad I had the brace. As you know, it's my second injection that I've had. I had one years ago for the other knee, and that one worked phenomenally well, just given the situation I had. I think my situation in the medial side, I still have the same issues. So the injection is an easy process and is not painful. So I would highly recommend seeking out getting one if you need one.
Right.
Yeah.
And obviously, as an orthopedic surgeon, patients who have a meniscus tear and arthritis is actually a last resort. And that's why we haven't done a surgery for you, and we're going to continue to try non-operative treatment. But there are some situations where we do a surgery in people who have a meniscus tear. And that's really if the knee is unstable, if there's painful clicking, if the knee's locking up. But if you're not having those specific symptoms, we know from the clinical research that's been done over the last decade or so, that if you have a trimming out of your meniscus, it can actually speed up the arthritis and wear in your knee. So for now, we're really just managing your symptoms. And obviously, if you develop painful clicking, locking, your knee's giving out on you, then we're going to be talking about an arthroscopic surgery. But until then, there was something else that you mentioned to me, the meloxicam, that you found very helpful in managing your symptoms. So meloxicam's an anti-inflammatory medication. Do you mind talking about your experience using that and how it's been helpful?
Sure. I started taking meloxicam on 2 days before the hike started. The plane flight for 40 hours of flying was not good on my knees, so I had some issues as far as after the flights were over. I went up taking meloxicam, and within 2 days, honestly, the first day was August 1st of the hike, and 2 days of being on meloxicam, I almost had 100% relief. I don't like taking lots of drugs, so I'm trying not to take meloxicam now,
Right.
Unless when I need it. But frankly, for this situation compared to ibuprofen, not even comparable.
Right.
The relief I had, including stomach-wise, meloxicam was much easier on my stomach than ibuprofen. I was taking 800 milligrams ibuprofen every day for the last week of July,
Right.
and I stopped taking it. Went on meloxicam, and it was a much better solution for me.
Yeah. So I guess in summary, we can say that if you have an arthritic knee, we shouldn't be reducing our activity level, because actually in the long term, that's detrimental, isn't it?
Yeah, absolutely. And I think it's very systemic. It's a systemic thing that's happening at the moment, where we're seeing higher volumes of people enter into a sedentary lifestyle after even small amount of injury.
Right.
And so I think most people don't understand this about our healthcare model. Mike understands it very well, but in Arizona, especially, we have direct access to physical therapy. So most insurance companies outside of Medicare will allow us to have direct treatment and approach to the patient. So an individual that has any kind of ailment or injury come up, they can get right in, see a physical therapist. If they think that it's a sports orthopedic injury or an orthopedic injury, even if it's onset of vestibular dysfunction or any sort of generalized deconditioning case, we can diagnose that, treat that, and then put them through the right avenues to get further care. It doesn't have to be a direct admit to the primary care physician first.
Yeah.
So it's another way that we've stepped the barrier down in order to speed up the care to the patient.
Yeah. Some of the other issues around this same topic are that, if you have a knee injury and you feel that you need to reduce your activity level, it actually has long-term consequences for your general health. You lose the cardiovascular benefits of exercise. You lose muscle mass. As we get older, we all lose muscle mass too.
Right.
And then that puts you at risk of hip fractures and falls in older age. So it's really important that when people have knee pain, they probably come see you or me and get an evaluation and treatment and get back on the right track.
Yeah, absolutely. I think the cat's out of the bag when it comes to longevity and muscle wasting. If there's any kind of small injury that occurs, the best thing that we can do is address that, treat it, and get you back on the road to recovery and back to really performing your activities of daily living and reaching your goals. And so if we can do that, we know that at the end of the day, we're promoting longevity.
Yeah. So Mike, in summary of the treatment that you've had some excellent physical therapy with Dan. You had a special type of brace, a custom-made brace to offload the area where there was arthritis in your knee. You did the injection, you took meloxicam, and through all that, you've remained active, which also is very important for the health of the knee. It's important for the health of the knee because the actual cartilage in the knee doesn't have a blood supply itself. It gets its nutrition from the knee moving. There's fluid in the knee that supplies the nutrition to the cartilage. So again, that's another reason why when you have a knee injury, it's important to keep active. And that might mean some modifications to your activities. So many of our patients, actually, when they have arthritis, they find hiking difficult. And so other aerobic exercises like swimming or cycling, which are non-weight bearing, are usually better tolerated. But it's really important to be active throughout knee issues.
Yeah, and I'll touch on that a little bit more. I think most people, when they come down with an injury, the initial response is, I just shouldn't do anything, right? I should stop what I'm doing. And so with the guidance of a physical therapist, we can promote your continued activity and happily guide you and educate you in the things that you should be doing and the things that you should be avoiding. And in Mike's case, that may have meant avoiding deep end ranges of motion to his knee, maybe shutting down some hiking volume until he sees a specialist. For somebody else that has a smaller injury or generalized deconditioning, that may be monitoring their cardiovascular volume as they return to walking. So it really does run the gamut on what we should be doing, but promoting the overall wellness of the individual is in our wheelhouse.
So Mike, we've heard that you've got some awesome challenges coming up. Do you want to tell us a little bit about those?
I've got I think I'm going to be climbing Mount Orizaba in Mexico City in February with the same group I just used. And I've got a longer term I want to hike Mount Vinson, which is Antarctica, which is a 30-day hike.
Okay. It's going to be a challenge.
Yeah.
Okay, fantastic. Well, Dan and I have our own challenge coming up soon.
That's right.
You want to tell people about that?
Sure, yeah. So we'll be doing Dawn to Dusk, which is a mountain bike race in the back of the McDowell's. So that'll take place in December. That's a community event that we do every year. It's a great way that we can kind of get out there and involve in the community. So we'll be out there. Endurance Rehab will have a tent. There'll be a corporate sponsor out there at the event. And Dr. Saithna will be joining us. So we'll get to see his bike mechanics and see how his cardiovascular fitness is.
I actually hate mountain biking. I don't know if I told you this. I love road cycling. I actually, I used to do competitive time trial and I cycled the full route of the Tour de France. So actually, that's one of the reasons that we got you in so quickly, because I was just really inspired by the fact that you were trying to climb Kilimanjaro. I love endurance sport. Obviously, we treat all patients the same, but Dan and I have a really great relationship. And when he said what you were doing, I had to make sure that you're able to be successful. But that's just because I love endurance sports and love seeing other athletes achieve highly. But I hate mountain biking. But Dan's roped me into it. So yeah, that's what we're going to do.
Be a good day.
Yeah. So I think in summary, what we can say is that if you have an arthritic knee, then you shouldn't be reducing your activity level. You should be staying as active as possible. It's really important to see a very skilled physical therapist like Dan, so you get an individualized assessment, understand what the problems are, have a tailored rehabilitation protocol, and then obviously myself or other orthopedic surgeons or other sports medicine physicians can look at the other aspects from a more medical perspective. We have the option of injections, bracing, anti-inflammatory medication, and you can see that even with an arthritic knee and a meniscus tear, you've been able to achieve some phenomenal things. So other people out there who are just trying to do a smaller hike or just be active in their day-to-day lives should realize that actually it's achievable, and we can get really good function with an arthritic knee.
Absolutely.
So I really appreciate both of you coming on. Dan, where can patients come find you?
Yeah, so you can find us off of Frank Lloyd Wright and 101. That's our North Scottsdale office. It's tucked in near Westworld area. And then our North Phoenix office is located in Arcadia. Closest cross streets are 36th Street and Camelback. So, yeah.
Mike, I don't know too much about what you do. It's a totally different world to medicine. But I think you help companies that are in difficulty turn them around. Is that right?
Yeah, I'm a director for a few firms in town. There's a company called Copper Point Mutual, which is an insurance company here locally. A medical device company called Oral Clean. But most of my business is focused on either turnaround situations or big areas of transition where I will step in as a interim CEO or interim president. Typically not long term. I'm trying to help transition the company, but to either stop the bleeding or help work through transition. I don't want to be anchored to someplace for long term.
Yeah. Well, that's fantastic, and I'm glad your work allows you to continue doing all the hiking and stuff you want to do. I'm looking forward to seeing your future successes.
All right. Thank you.
Thank you very much, both.
Yeah.
It's been a real pleasure having you on.
Thanks.
If you have questions you'd like a medical professional to answer, please write us and we can ask those questions for you at dr.amber@scottsdaletopdocs.com. You can also find us on Instagram, YouTube, and Facebook in our group, Scottsdale Top Docs. If you'd like to be featured on an episode, please make sure you reach out to Amber Enright, Dr. Brooke, or Dr. Saithna. You can also email us at dr.amber@scottsdaletopdocs.com.